Bismillahirrahmanirrahim. Today we will discuss about the pelvimetry. Now, first of all, what is pelvimetry? Pelvimetry is the measurement of different diameters in bony pelvis at three levels. The three levels are the pelvic inlet, pelvic outlet, and pelvic cavity. Now we take three types of diameters. These are the anterior, posterior diameter, transverse diameter, and oblique diameter. Now where we study pelvimetry, we study it in the skeletonized model like this, that is derived from the cadaver, and we can study it in patient, that is known as clinical pelvimetry, and we can study it in the x-rays, that is known as radiological pelvimetry. First of all, we will discuss at the level of pelvic inlet. Now you know that this is pelvic inlet, and it is bounded posteriorly by the sacral promontory, anteriorly by the upper margin of pubic symphysis, and on each side it is bounded by linea terminalis. Now at the level of inlet, we take three types of measurements. These are the anterior posterior measurement, transverse measurement, and oblique measurement. Now first of all, anterior posterior diameter. Anterior posterior diameter is like this, from the midpoint of sacral promontory to pubic symphysis. This is known as conjugate. Now remember that there are three types of conjugate. First one is the anatomical or true conjugate, that is distance from the midpoint of sacral promontory to upper margin of pubic symphysis. Now second one is the obstetrical conjugate like this, and this is the distance from the midpoint of sacral promontory to midpoint of pelvic surface of the pubic symphysis. And after that, third one is the diagonal conjugate like this, and this is the distance from the midpoint of sacral promontory to lower margin of pubic symphysis. Now remember, three conjugates are here. First is the anatomical conjugate, second is the obstetrical conjugate, and third one is the diagonal conjugate. Always remember that anatomical conjugate is the true conjugate. And remember one thing here is that we can only measure diagonal conjugate, and we can measure diagonal conjugate on pelvic examination like this, and we pass two fingers, and we try to palpate the sacral promontory, and then after that we place other hand on the lower margin of the pubic symphysis. After that we withdraw the overhand, and we measure the distance from this margin to the tip of the middle finger, and this is the measurement of the diagonal conjugate, and it is about 11 centimeter. And we can and remember here that our index finger is 1.5 centimeter small than the middle finger, and when we subtract 1.5 centimeter from the measurement of the diagonal conjugate, we can derive the measurement of the obstetrical conjugate. After that, after the anterior posterior diameter, remember that other diameter is the transverse diameter. Now transverse diameter is like this, and it is across the pelvic inlet, maximum distance at pelvic inlet. And after that, oblique diameter. Now oblique diameter is like this, and it is from the upper margin of the sacroiliac joint of the one side to the iliopubic eminence of the other side. Now remember that at inlet, maximum diameter is the transverse diameter. After that, at outlet, now outlet boundaries are anteriorly it is bounded by lower margin of pubic symphysis, posteriorly it is bounded by tip of coccyx, and laterally it is bounded by conjoint ischiopubic rami, ischial tuberosities, and sacrotuberous ligament. Now here again three types of diameters are. Now anterior posterior diameter is like this, from the distance between the lower margin of pubic symphysis to tip of coccyx. After that, transverse diameter is like this, and it is known as tuberous diameter, and it is the diameter between the two ischial tuberosities. After that, oblique diameter is like this, and this distance is from the conjoint ischiopubic rami of one side to the midpoint of sacrotuberous ligament of the other side. Now remember one thing here is that at outlet, maximum diameter is anterior posterior diameter. After that, in pelvic cavity, now this is pelvic cavity. Now boundaries of pelvic cavity are: posteriorly it is bounded by pelvic surface of the sacrum and coccyx, anteriorly it is bounded by pelvic surface of body of pubis and pubic symphysis, and on each side it is bounded by pelvic surface of lower part of ilium, ischium, and two rami of pubis and ischium. Now here are three types of diameter again. Now first diameter is the anterior posterior diameter is like this. Posteriorly from the S3 vertebra to the midpoint of pubic symphysis, its pelvic surface. After that transverse diameter is like this, and the transverse diameter is in the cavity between the pelvic surface of ilium and ischium. And after that oblique diameter is like this, and it is from the lower part of the sacroiliac joint of one side to the midpoint of obturator membrane of the other side. So after that, remember that in pelvic cavity, in this cavity, maximum diameter is oblique diameter. So remember it like TOA. T is the transverse diameter is maximum at inlet, and O oblique diameter in the cavity, and A is the anterior posterior diameter, and this anterior posterior diameter is maximum at outlet. So after that, what is the clinical importance of these maximum diameters in the bony pelvis is that, considering all the diameters of inlet, cavity and outlet, in normal act of parturition, the biparietal diameter of the head of the baby fixed with the transverse diameter of the inlet, then it descends spirally by engaging with the oblique diameter of the cavity, and finally anterior posterior diameter of the outlet. So head rotate to accommodate the maximum diameters of inlet, cavity and outlet. So it was all about the pelvimetry. Now you can remember these diameters from this table. In this table, see that this is the diameters of the brim, cavity and outlet. This is the anterior posterior diameter, oblique diameter and transverse diameter. Now at brim 11, 12 and 13, cavity 12, 10.5 and 12, and at outlet these are the 13, 12 and 11.